we have the results from our first poll question. We'll have several throughout this hour-long program, but here's the first poll question. Remember, we asked you this: what kind of plan does your business have for a pandemic? We have a good deal of response here already. And Bill Doyle, what have you found?
Well, it's very interesting. We have roughly 15% of our people responding have indicated that they have a complete plan.
They have a complete plan?
They have a complete plan. We have roughly 50% of the viewers responded in saying that they either had a plan in place and it was not complete, or that planning was in progress. And we have roughly 33%, or 1/3 of our viewers, who do not have a plan at this point. And for people working on the plans, I hope that the template that we mentioned would be a good and useful planning tool for them.
And again, that is available on our website. We'll keep hitting that throughout this hour-long webcast. But for the folks who don't have it, about 1/3 who haven't put together a plan, that's exactly why we're putting this webcast together. Now, we do have another poll question for you, and we ask you this: what prevented development of a plan for your business? Why haven't you done it yet if you haven't done it? A, you simply don't know how to do it. B, no management support to do one. C, you simply do not have the time, or you don't think it's important to have a pandemic preparedness plan. Or D, you really don't think a pandemic is likely. Interesting. Again, all you have to do is move your cursor to whichever A, B, C, or D, and then hit the submit button, and we will get your response. But we want to turn back to our conversation with our guests and our host, Bill Doyle.
Chad, as we get into the planning stages, it's very important for people to understand what roles different organizations and so forth will play. Could you explain what role, like the local public health department would play?
Yes, our biggest role would primarily be surveillance and providing information out to the community as we receive it from either the World Health Organization or the Centers for Disease Control and Prevention. And primarily what we would be doing would be increasing our surveillance in our local community, as would most other health departments, to see if they're having any influenza-like illness in their community, and then from there taking the proper steps to make sure that the spread is minimal. And basically that's what we'd be looking at, but primarily getting the information out to the community is key, and accurate information, because we don't want to have to deal with rumors and misinformation of the public.
Now, as businesses develop their plans, what kinds of things should they have in their plans, and what type of interaction, for example, would they have with the local public health department?
Well, I think they would really want to look at the overall population that they are working with in terms of their employees, because as the video stated, that they're looking at a 40% reduction in their staff, and they're going to need to know what they can do in terms of having their employees work from home, possibly to keep their business going. And that's one of the considerations that they should be looking at, and we can help at the local level in terms of the public health and helping them plan for that. And then we also, like you had alluded to before, certain resources that are available on your website, and there's also other websites out there that provide templates that are standardized. We don't want people having to reinvent the wheel. There's plenty of them out there, so we want to make sure that they have that.
There are wonderful resources out there.
Yes.
Colleen, do you have anything you'd like to add?
Sure. Plan is the important keyword here. And from a medical perspective, you want to make sure that you have your prescription drugs available, and hand hygiene supplies, and over-the-counter medications, and all kinds of things like that. You want to have water, food available. Probably one of the most important things that sometimes gets overlooked is absenteeism policy, because we do want people to stay home when they're sick. We don't want them coming to work, and they're always a little concerned about what their employer is going to say at that point in time. So you want a written policy on absenteeism, I guess, and encourage your associates to stay at home.
So really, the first line of defense here, as simple as it sounds, is a little bit of that hand cleanser at work, because that's really the first line of prevention, just keeping your body clean.
Absolutely.
And it doesn't take a lot of money, and it doesn't take a lot of pre-planning.
Correct.
But it is that vital.
Yep, you're right.
Colleen Abrams, thank you for that.